We knew it for a long time that this pandemic is sort of something that's set in motion, events that are going to last for the next few years or decades, right? We actually felt that it was actually important to start modeling this, especially because our group and our collaborators actually have experience with modeling similar diseases, specifically influenza. The goal of this project was essentially to model weighted influenza-like illness curve in the current season, which is kind of special because it's actually being affected by a pandemic as well due to COVID-19. So essentially our idea was to model the current influenza season by explicitly using data from COVID case counts in the United States. And the reason we thought this was important was because the healthcare seeking behavior of people would actually change, and this would actually affect the evolution of the current influenza season. The way we achieved this was actually by developing a model that was able to effectively leverage historical influenza seasonal data and models from the past, and also leverage models that have been trained on more recent influenza data that's been contaminated by COVID-19 pandemic, as well as explicitly using COVID case counts as well. The current influenza season definitely showed some unseasonal peaks in the beginning around March or April of this year due to people going to the hospital even if they had influenza, thinking it was COVID, because both these diseases are at least at a high level, very symptomatically similar, at least initially. So we actually saw some unseasonal peaks, and towards the latter part of the season, maybe closer to the summer, the influenza season actually sort of settled down and came back to normal behavior, meaning similar to historical seasons as observed in the past. It feels pretty good to actually be contributing towards addressing real world challenges.